Good morning, everyone, and a very warm welcome to all of you to our International Women's Day event. It's our first online International Women's Day event, and in a way, I probably hope it's the last one and the next one is actually in person. The City of Whittlesea recognises the rich Aboriginal heritage of this country and acknowledges the Wurundjeri Wilam clan as the traditional owners of this place, and we pay our respects to elders past, present and emerging. Could I also acknowledge my administrator colleague, Ms Peter Duncan, our CEO, Mr Craig Lloyd, and members of his executive leadership team. This year IWD's theme is Women in Leadership, Achieving an Equal Future in a COVID-19 World. And can I just note at this point that we will be recording this session. Could I warmly welcome our facilitator, Sandra Morris, from the Health Promotion Team at Women's Health in the North, and of course our really amazing panel of speakers this morning. Lisa Thorpe, who's the CEO of Bubup Wilam Aboriginal Child and Family Centre, Sarah Alchin and Kirsty Branagan, President and Vice President of the Lalor Running Club, Bronwyn Clark from the National Growth Areas Alliance, and finally Gulhan Yoldas, who's the President of the Whittlesea Interfaith Network and the Community Engagement Manager at Sirat College. And I thank you all for your contribution today. In opening this forum, I just wanted to make a few introductory remarks. Obviously, it's a great pleasure and honour for me to be here this morning. International Women's Day is an opportunity to reflect on the advancements that have been made towards gender equality and human rights. However, it's also critical that we acknowledge that we still have a journey ahead of us. For me personally, IWD is so important as it's a day of reflection. Of all the wonderful women I've had the pleasure of meeting throughout my life, and the many women who have inspired me for their selflessness, their courage, determination and their achievements. But can I share with you a few concerning facts regarding the situation in Whittlesea, but more broadly as well? Women are impacted by family violence at a higher rate compared with the metropolitan Melbourne averages, and are the majority of victims in sexual assault cases. Women still do a substantial amount of domestic work, more than men. Women are more likely to care for an elderly person or a person with a disability or illness, and I've certainly fallen into that category. Women are more likely to hold a bachelor degree or higher than men, but are overrepresented in lower income brackets. Gender pay gap nationally stands at 14%, meaning women take home on average $253 less than men every week. And I was actually very interested but surprised to hear the other day that Australia still ranks 54th on gender pay disparity rankings. It's quite astounding and alarming. The City of Whittlesea's vision is a place for all, and we have an ongoing commitment to gender equality and prevention of violence against women. Local government intersects with many settings where people live, work, learn, socialise and play across all ages and stages in life. There's obviously a huge opportunity across all these settings to change the way we do things and remove barriers to equality. And in practice, this includes initiatives such as women's leadership programs, grants to increase female participation in sport, bringing a gendered lens to how we design lighting in our public places. We really welcome the introduction of the Gender Equality Act, due to come into effect later this month, as this Act obliges public sector organisations, universities and local councils to take positive action towards achieving workplace gender equality and ensure that organisational policies, programs and services promote gender equality and a fair and equitable for everyone. So just a few concluding remarks. It's really pleasing to see the signs of positive change, as I indicated earlier, but there is much more to do, and there are times that it does feel like we take one step forward and two steps back. Now it's time to get started with today's discussion, and I'm really looking forward to hearing from all our panellists in relation to what their organisations have done and their personal support through the pandemic. And I'd now like to hand over to our facilitator, Sandra Morris, and tell you a little bit about her many achievements. Sandra has more than 2 decades of senior leadership experience in the women's health and family violence sectors and in service provision in government, health and not-for-profit organisations. She's the manager of the health promotion team at Women's Health in the North, which includes a portfolio areas of gender equality, prevention of violence against women, sexual and reproductive health, and economic equality. She's a local herself and lives, works and has raised her family in the northern suburbs. Sandra's deeply committed to creating high quality and accessible programs and services for marginalised women in our community. And finally, she's so well placed to lead us in our discussion today of women in leadership achieving an equal future in a COVID-19 world. So thank you all again, and over to you, Sandra.
Thank you. Thank you, Lydia. Sorry, I was having, of course, a technical issue right at that moment. Thank you, Lydia, for that great introduction and lovely welcome. And I'd like to say thank you to the City of Whittlesea for hosting today's event and for inviting me to join you to celebrate women's achievements, especially those of women who live and work in the City of Whittlesea. Before I go any further, I'd also like to acknowledge the traditional owners of the land that we are holding this meeting on today, this forum, the Wurundjeri Wilam clan, and pay my respects to their elders past, present and emerging, and to acknowledge that the land that we're meeting on today has never been ceded. Happy International Women's Day, everybody. I love International Women's Day because it provides an opportunity to reflect on women's strengths, achievements and the challenges still ahead. And this year's International Women's Day theme is Women in Leadership, Achieving an Equal Future in a COVID-19 World. And I'm going to provide a brief overview of some of the gendered impacts of the COVID-19 pandemic and why I think women's leadership is really critical in the recovery period. And then I'm really looking forward to having a conversation with the amazing panellists who will be generously sharing their personal stories of life and leadership during the pandemic. Before I launch into the forum, I just want to let you know that we encourage you all to join in and to use the chat function if you've got comments or questions for the speakers, and we'll try and respond to those. I'd like to also just acknowledge that Amy and Madeline are behind the scenes making this all happen. There's a lot of things that go on and putting on an online forum, and I just wanted to make sure that we all acknowledge their hard work. So we'll hear from the speakers. I'll present a little bit and then we'll hear from the speakers, and I've got some questions for them and hopefully you've got some questions for them too. So I'm looking forward to that. So why am I here? Lydia's touched on that today, but me in a snapshot. As I live in the north, I've done a lot of work with the City of Whittlesea over the years in my role at WIN. And I've been really lucky enough to spend my career actually working on, trying to change the world to make, I suppose, in my own small way, to make it better for women and those who are socially disadvantaged. I've spent so much of my career working to address issues affecting women that my now grown-up children, if someone asks them what I do for a living, they describe me as a professional feminist, which I wear as a badge of honour. I work at Women's Health in the North, and our mission is to eliminate gender inequities and to improve the health, safety and wellbeing of women who live and work in the northern suburbs. And as I said, we've worked in partnership with Whittlesea Council to achieve this aim, and most notably contributing to the Council's gender equality and family violence strategies. And when we also have a focus on leadership, and we do this by providing leadership on the issues that we're working on, but also harnessing the power of leadership across the region and supporting local leaders to use their influence to improve the lives of women and those who identify as women. Like for the rest of you, 2020 will be a year that I'll never forget. It will always be a marker in our lives. COVID-19 hit us swiftly and it had wide-ranging impacts, and as a community it required us to change and adapt in ways that were previously unimaginable. This forum today is a really good example of that. Who thought we would have been sitting here 12 months ago talking to each other online in this way? It wasn't a fair pandemic. It impacted differently on women, men, gender diverse people, depending on their age, disability, socioeconomic status, Aboriginality, ethnicity and visa status. In brief, it had a disproportionate impact on those already experiencing structural disadvantage and discrimination. But on the flip side, it also presented us with opportunities to think and work differently and to come together as a community. And our speakers today are going to be telling us about their personal experience of the pandemic and how they stepped into a leadership role to build on the opportunities they identified and to create positive change for their community. And I was reminded just before we started that often people don't identify themselves as leaders or showing those leadership qualities, but we know that many of us have those in us, and the women on this panel today do that work without even thinking about that themselves in that leadership role, I think, sometimes. So for me, one of the key outcomes of COVID-19 was that it put a spotlight on gender inequality in a way that those of us that have been working in that area for many years could never have imagined. And I'm going to give you, Lydia touched on some of the things that I'm going to speak about, but I'm going to give you a snapshot of 4 areas in which COVID-19 was gendered and had a disproportionate effect on women. And this isn't an exhaustive list, these are just 4 areas that I picked out. But they're economic security, violence against women, sexual and reproductive health and mental health. I want to start with economic security. So 55% of job losses due to COVID-19 were experienced by women. The majority of casual workers unable to access JobKeeper were women. Women depleted their superannuation at a higher rate than men because they were withdrawing their emergency COVID-19 funds as part of the economic recovery package. Women performed far more of the unpaid labour and additional educational support in the home during lockdown. And the majority of essential workers were women, and some of those were also in the lowest paid jobs, and these workers included teachers, cleaners, early childcare workers, hospitality workers and retail workers. And this also put them at higher risk of contracting the virus. Family violence, it's really difficult to get a picture of exactly what was happening in family violence during the lockdown, because one thing we do know was that there was an ominous reduction in calls to Safe Steps Family Violence Response Centre. And while at the same time there was 200 calls a week to Victoria Police about family violence incidents. And I think that what that's telling us that women were unable to make those phone calls to make a self-referral about the family violence that they were experiencing, but the police were still attending family violence incidents. And what we know about police attendance is that they usually go to the most serious incidents because someone in the home has reported that, or a neighbour or somebody's seen that going on. So there was a mismatch. We also know that in between the lockdowns, the phone calls went back up to Safe Steps, and we believe that's because women were out of the home and able to use their phones again and were able to make those calls, and other people experiencing family violence too were in the same position. I'm focusing obviously on women today because it's International Women's Day. There was a 50% increase in family violence matters in the Magistrates Court, and that aligns with the police call-outs. And interestingly, there was a 94% increase in calls to men's support services, and that was driven by men who felt that they needed support for their behaviour, and which is a great outcome. And I think that we really need to be promoting the support that men need when they identify that they're at risk of being violent or they've already used violent behaviour. In the area of sexual and reproductive health, 1800 My Options, which is the statewide pregnancy support service, reported that women were delaying their calls to the service and they were presenting much later in their gestation. largely because lots of us know we weren't going to the doctors or we weren't going out to do shopping, so people weren't identifying identifying that they were pregnant early in the pregnancy. Women were also reporting that they were experiencing family violence, including violence of a much more severe nature. They said that they were unable to pay for sexual and reproductive health services due to job losses and financial difficulties. And there was a lot of anxiety amongst women about the impacts of the virus on their pregnancy and the fear of contracting the virus when accessing health services. And finally, mental health. There's a lot of research done into mental health in this period during COVID-19. And I know, all of our mental health, I think, was affected by the lockdown. But during COVID-19, women experienced higher levels of depression, anxiety and stress than men. One study showed that 35% of women had moderate to severe levels of depression compared to 19% of men. 27% of women who were surveyed had moderate to severe levels of stress compared to 10% of men. And 37% of women aged 18 to 24 reported suicidal thoughts compared to 17% of men. So during lockdown, women were more significantly likely to feel nervous, that they were lonely and that everything was an effort. And in fact, in 1 month at the Alfred Hospital in the Women's Mental Health Clinic, they had a 2,800% increase in demand, which is just huge. So what does all this information tell us about what we need to do to make sure that the COVID-19 recovery is gender equal and that the recovery effort addresses structural disadvantage and discrimination so that women, men and gender diverse people benefit equally? Well, a few things that it tells us are that we need to ensure that women's voices and lived experience are included in all current COVID-19 recovery efforts and also in planning for future natural disasters, because this is what COVID-19 was. We need gender-sensitive budgets, economic policy and economic reform that considers women and responds to the gendered nature of the workforce and takes into account caring responsibilities. We need to promote flexible working and family-friendly policies in the workplace and to improve access and affordability of childcare. Now, I work for a women's organisation and we didn't have a working from home policy before COVID-19 and we thought we were really flexible, but I think what we found out, we weren't as flexible as maybe we could have been. So that's been a big learning for us. We also need to improve their care of the elderly because aged care is a gendered issue, because more women are in aged care than men because they live longer. And we need to ensure that public spaces are safe for women and girls, especially during natural disasters like pandemics, when we need to have meeting points and where people are coming together to stay safe. So that brings me to leadership. So how does the gendered impact of COVID-19 guide our future leadership action? It's critical as we recover from COVID-19 that women leaders are represented at all stages of the COVID-19 response, recovery and rebuilding efforts, at a local community level and at all levels of government and private industry. We need leadership that doesn't forget what we learnt during COVID-19 so that we can build on the opportunities that it presented and so that we can pave the way to a gender equal future for our community and a socially just community in the future. My personal observations over the years of what makes a great leader is that great leaders are convincing, inclusive, inspiring, respectful and motivating. They build relationships with others through empathy, listening and establishing an authentic connection. Most importantly, they identify a problem, they come up with solutions to meet the problem, they share the solutions and their message in a clear, accessible way, and then finally they enlist the power of their supporters to do something about the problem. All of the women on the panel today demonstrate these characteristics and are providing leadership in different ways and in different places in the city of Whittlesea. So I'm going to leave you with those thoughts and enough from me, and I'm going to introduce you to the panel and we're going to have an opportunity to hear about how they took up the leadership challenge to support their communities during the pandemic and the extended lockdown here in Melbourne. And as I introduce them, I'm going to get them to raise their hand because I know not all of our screens look the same, so you know who I'm talking about. And then they'll have an opportunity to answer some of the questions that we have for them about their lives over the last 12 months. And don't forget that you can type your questions in too. And with my newfound IT skills, I'm going to be trying to share those with the panellists. So I'll run through and introduce all our panellists. So Lisa Thorpe. Lisa is a Gunditjmara Gunai woman. I knew I was going to muck that up after I'd spoken to Lisa about that. Lisa was born in Yoldas, Victoria, but has spent most of her life in Melbourne. Lisa is the CEO of Bubup Wilam for Early Learning Aboriginal Child and Family Centre, and she's been integral to the inception and development of Bubup Wilam, and is focused on ensuring the right to self-determination for Aboriginal children and their families. Lisa has a Master's in Public Health from Deakin University, where she worked as an Associate Professor with the Institute Curie Education for 7 years. And in the past, Lisa has worked in and around family violence and sat on the Aboriginal Women's Refuge Board for 10 years. Lisa has lived in Thomastown for 35 years and has 4 children and 4 grandchildren. So Lisa, thank you for being with us today. And Bronwyn Clark. Bronwyn is the Executive Officer of the National Growth Areas Alliance, the peak body representing 20 councils on the outskirts of capital cities where 1/5 of the Australian population lives. The National Growth Areas Alliance advocates for a dedicated focus on Australia's fastest growing outer suburbs. This is supported by a national research program proving the need for and the benefits of long-term planning and funding of critical infrastructure. As Executive Officer, Bronwyn brings advocacy, policy and government relations expertise to the Alliance, and she's consulted extensively to local government, small businesses and not-for-profits, and has worked with the federal government on multilateral trade negotiations, including representing Australia at the World Trade Organisation. Kirsty Branagan. Kirsty is the Vice President of the Lalor Running Club and is also one of the Level 2 immediate coaches, and normally she works as a primary school teacher locally. However, she's had an extended time away from work due to a cancer diagnosis in January 2020. She recently completed her treatment and is looking forward to getting back to work in the coming months. Kirsty has found a wonderful support network in the running community, both with her running journey and throughout her treatment. And she also ran a marathon in Hawaii in 2019, but you probably already know that if you've already met her, because she tells everyone that she meets about it. And then Sarah Alchin. Sarah is the current president of the Lalor Running Club and is also a busy working mum of 2 primary school age boys and runs a small business with her husband. She's a financial crime professional, which I have to say sounded really exciting as a crime lover, at one of the big 4 banks. And Sarah uses running not only to stay fit and healthy, but also as a social network of other like-minded people, what this really means is that she spends most of her time running time talking. It's like my walking time. Gulhan Yoldas is the president of Whittlesea Interfaith Network, a columnist for the Australasian Muslim Times newspaper and the community engagement manager at Al-Sirat College. Gulhan has a robust history of advocacy for gambling industry reform, interfaith engagement, Muslim women in leadership and mentoring young people as spokespeople for their community. Gulhan has published 4 books on the experiences of Australian Muslims. So I think that you'll agree that the women that you've just met bring an extraordinary breadth of knowledge and experience across the community in Whittlesea. So I'm going to launch in now. And my first question, I'm going to ask a question. I'm going to give the panel all opportunities to answer, all of them an opportunity to answer, but so my first question is, throughout COVID-19 and the impacts of the extended lockdown, what did you all notice happening in your community that nudged you to take action and to lead change, and what did you do? And I'll start with you, Lisa, if that's okay.
Hi, everybody. The last 12 months for us has just been a total blur of actually what's happening out there, and sitting in a space where we operate in an early years space where we're expected to stay open when the whole world around you is shut down and the Aboriginal community itself had shut down. How the state of Victoria actually looks after Aboriginal early years, we actually had no supports at all, because it's the Commonwealth that looks after the childcare component of it. We were just left in a space where we just had to work it out really, really quickly. What the effects after the COVID, we still had families coming in, even when it come to the hard lockdown, and it was only open for the most immediate families of the frontline families. We still had 20 children coming in. At no point did we lose any staff. We ensured You know, it was important that we didn't lose any of our staff, because we'd spent so many years building the staff up that to lose them at this current point in time, we then lose and invested the investment of working with the workforce, which was important, and actually how we looked after the children that we actually service. So we maintained that. We actually had to quickly adapt to doing online learning, plus also stay open and rotate all the staff processes, and actually how we can come in and out of it. We had to still go down the Bubup. So our day didn't really change, only the amount of people that we've seen and how we actually interact with other people. Our families have only just yesterday, we opened the doors that they can actually now take their children into the rooms. We've actually just, which put a strain on how it works, because the family interaction couldn't happen. We've also now got a situation where family violence has always been, like in and out of the whole process. And we're not frontline family violence organisations. What we actually are is we're dealing with families every single day who are living their life in a situation trying to stay out of family, or who are actually operating in it at some degree. Currently, we actually have 11 orders actually in place. That's family violence orders by families amongst families, but also child protection orders. There's so many things that we were operating with no supports around us. So Bubup actually we actually just invested in ourselves and looked after ourselves. We got hurt really badly when the JobKeeper stopped on the 1st of July last year. For the rest of everybody, JobKeeper, it's finished now though, isn't it? But we actually lost the JobKeeper back in July, and that really, really hurt us. We actually sent letters to both the state and federal ministers about what happens if Bubup, Wilam and the other local...
Sorry.
Is that... Yeah, so we actually, Melbourne was in hard lockdown, and Bubup, Wilam and Yapra, the other Aboriginal Early Years Centre, we both had to stay open. The whole Aboriginal community was in lockdown, and we were saying, well, what happens if we get a case of COVID-19 when we actually have the same community? It was a high risk of transmission. No one cared. We were left to actually fend for ourselves and just be left hanging. We've got more sanitizer that we could wash every child in. And actually, that's the only supports that we got, was very basic. And actually, we couldn't wear and didn't wear PPE because it wasn't effective to actually work with children walking around in PPE and masks. So we got through it. We actually survived it. We're at the after effect that we're all exhausted. The staff are really exhausted, and no staff have got sick leave. Because every time, I think that's the big impact for us, is that no one now has any entitlements, because every time you got on well, you had to leave and go and have a COVID test. So that we actually are suffering more in the after effect than what we actually were during the time. Yeah.
Thank you, Lisa. Thank you. Sorry about my alarm going off then. That's bad. Thank you. I think what you've just been talking about is really highlighting once again the role of the essential workers, and how women who are in childcare, which is one of the essential working roles, were not looked after by the economic policy that was put in place, and the impact, that's just one of the impacts in that setting. So thank you.
Can I just add one more thing and talk about that?
Yeah, definitely.
You know how the Commonwealth government said it's free childcare for everybody over this point in time, and so the way childcare works itself is actually for working parents, and so the bulk of our families on the low income or actually on benefits. So when they said you're going to get 85% covered of your childcare, the bulk of ours are already on 80%. So it never increased us at all. We never got an increase, and we never got family incomes, the family contribution, and we never got an increase from the Commonwealth. So that's also the economic impact that happened to us.
Thank you, Lisa. Thank you. Gulhan, I'll get you to tell us through a little bit about what happened for you during COVID-19 and what you noticed happened in your community and what you did.
Firstly, I'd like to thank you for giving me this opportunity and this platform in celebration of International Women's Day. There's a lot to celebrate, and there's a lot of work to be done, clearly, and it also happens to be my mum's and my aunt's birthday. on International Women's Day. So I also want to acknowledge the ongoing custodians of the land on which we stand and pay my respects to their elders, past, present and emerging. And I commit to listening and learning about how I can better support First Nations people by educating myself, my family and my community. So we're an incredibly diverse community. We at Sadat College, for instance, we have over 50 different ethnic backgrounds represented. We have the entire spectrum of migration, from new migrant families all the way to, I think we also have a couple of Indigenous families there as well. So the first things we looked at doing immediately after the lockdown was announced was to focus on the mums, because we are under no illusion that if you have the mums well looked after, and the mum's mental health is very, very important, and it impacts on how the rest of the family is. And I do agree that women were disproportionately impacted by COVID. Just going through some of the things that we decided to very early on, there was a lot of fear, there was a lot of anguish, there was a lot of uncertainty, and I think that was felt across the board in our community. Everyone had to learn very quickly how to pivot through the systems. Being a school, we need to ensure that there was a continuation of learning for the students. And one of the challenges moving on in the community engagement space was, we're very much around bringing people together. So that's something that we had to stop doing instantly. So a lot of our programs, we needed to transform them to online platforms, and we continued to focus on mums. So we moved for instance, one of our major focuses over the past few years with the support of City of Whittlesea is to increase participation of women in sports and recreation. And one of our very popular programs is the Pilates program, the Friday Pilates program. It's just something we've ran for so long now. And it was a shame that, instantly the women that used to participate in that knew that they had a platform every week where they'd be able to socially gather. And I recall someone was mentioning also socially using sport as a social platform is very, very powerful. So that was moved online. Another thing that we had was the peaceful parenting programs. Now, what we needed to do was acknowledge the situation that we're in. So the peaceful parenting programs needed to include how to deal with this current situation and how to support your children, especially in their mental health during this pandemic and sudden change, and just to identify risks of disengagement or children that are disengaged from school, because it's a stressful situation to be in. So we tried to give parents some tools and resources in how to deal with those situations. Another program that we moved virtual is we wanted to have a social outlet, because during lockdown, you're not allowed to go visiting, you're not allowed to, social environment it's gone. So we needed to have a social platform. So for instance, on Friday nights, we had the ladies catch-up program, Ladies Friday Night Catch-Up. So that was like trivia night. We would invite guest speakers. So Manal Shihab from Shark actually came along and talked about gaming and its correlation with gambling harm, because during lockdown, a lot of young people were using more devices, and she had a chat about, how there is actually an industry, an entire, predatory industry that's targeting young people. So it was very eye-opening presentation. We not celebrated, but we acknowledged Are You OK Day, and that was a very emotional session actually, with women just sharing their feelings and the resilience, but also how hard it was during lockdown. So we just provided a safe space for women to be able to have those talks. Mental health, wellness, self-care sessions, we ran plenty of. We really wanted to keep the community engaged during that time, and I think moving forward, I totally agree that we need more resources to be able to offer those services and have those targeted intervention programs, not just for the students, but for the mums, the parents. We do need to have those that support to be able to supply those programs. We ran programs for mums with young children. So we normally run Islamic Storytime program during the week, and because we needed to cancel that, we moved that to bedtime story time. So each week it was actually really beautiful seeing maybe 50 little children on Zoom connecting through to bedtime story time, and their mums would often join them, maybe grab their bottle of milk, you know, 0 to 4-year-olds, and we'd sing songs and nursery rhymes, read a book, you know, and we even sometimes let them all open up their microphones, say hello to each other at the beginning and end of the program, or we'd open up the screen and let them draw on the screen. They loved it. It was a fun and interactive experience, and it got the mums to also see who else has small children and connect with those women afterwards in other programs. What else can I tell you? I also wear the Whittlesea Interfaith Network's president hat today. So we realised very quickly during the pandemic that we don't have a virtual presence. We don't have any way of communicating or continuing interfaith engagement during lockdown. And one of the wonderful things that happened is that we had a cultural heritage grant again from City of Whittlesea, and we asked if we can use that fund towards establishing a website, so we can collect and make an archive of the videos that we can produce in the interfaith space. The Women of Faith event that we had booked in for World Harmony Week, we transferred that online. We recorded that, and now it's available on our Whittlesea Interfaith Network YouTube channel. And the website, I think Gurinder is in the room today. Gurinder is actually end-to-end managing that entire project of establishing a virtual presence for Whittlesea Interfaith Network. So very, very happy to have her on board. An absolute wealth of knowledge and experience, and an absolute asset to our community. Is Gurinder. And I'll just wrap up with some negative things that did happen to the Muslim community in particular, and in the early stages while we're grappling with these changes of the pandemic, and while we're trying to keep our community together, and you know, we're dealing with, and people of faith and people that are observant of their religion who visit places of worship can absolutely relate to this. It's very difficult for, and also migrants that have been in the community, like in the Thomastown Lalor area for 40+ years. We had, you know, elderly people that might not have been, you know, connected online, that were sometimes showing up at the mosque, and, you know, there were people that were trying to explain the situation to them, and these people have been there, you know, every day of their lives, while they were there. So while we were trying to explain and run these programs to our community, we were also dealing with an added layer of difficulty when we had some media platforms using the opportunity to you know, label or discriminate against the Muslim community. So one particular thing that stands out, and that will continue to stand out in my reflections of COVID, is that there was an image of a full congregation, a mosque with a full congregation, that was published in a newspaper. And if anyone knows, like, the traffic in the area, like in Thomastown Mosque, or, you know, around other mosques, on Friday prayers or Eid prayers, it's usually very congested because a lot of people go to the Friday prayers or Eid prayers. And Ramadan and Eid during COVID-19 was completely different. It was a very sad experience because it was everyone was at home. No one went anywhere. And to see images like that published, and I actually researched, and those images were from 2017 and from mosques that we go to, that we know, and they were published as if they were you know, on that day, and that was very unfair. And there were several other instances where, you know, Islamophobia was sort of fueled. It was fueling bias where it lies, and that was unfair, and it just added another layer of difficulty during COVID. So I'd really like to see a bit more kindness, especially when communities are going through a difficult time like everyone else. And just touching on it earlier, I think a lot of sometimes I did receive feedback that our senior community did struggle, especially seniors that don't have internet access, and I would love to see more support around upskilling seniors, and also giving them, a device, something that they can connect with in the event that there's a lockdown, and just giving them basic information on how to navigate a device. I think that's very, very important moving forward.
Okay, thank you, Gulhan. There's a wealth. I'm sorry to cut you off, but there is just like an absolute wealth of information in what you've just said. And I think one of the things that really illustrates is the adaptability that we've all displayed in getting everything online, which sounds really easy, but we all know was a huge, huge amount of work. So thank you for that. Now I'm going to ask Bronwyn and Kirsty about their experiences during COVID and what they saw happening and what they did. Are you there, Bronwyn and Kirsty?
Sandra, did you mean from the running club or?
Yeah, from the running club. Like, okay. So throughout COVID-19.
So I'll hand over to the running club.
So that's Sarah and Kirsty.
Oh, sorry. Sorry, I apologise. Sarah and Kirsty. I'm looking on my list. Yeah, it's about the running club.
So what we found was a significant impact of COVID was that obviously our training sessions all stopped, and running events that people usually have their training plans for and that usually motivate people to get out and do their training were all cancelled. A lot of them went virtual, which is just not quite the same. And so we found we had people who had been consistently running 3 or 4 times a week just stop running. And the big concern for us, as well as people losing fitness and that sort of thing, was the effect that has on mental health when you're used to being active, being out, and running, suddenly not doing that, not being motivated to go and do that because you're not also having that social impact of meeting up with your friends and going for a run together. So we very quickly, most of our coaching leadership team are female, and we very quickly jumped into action, as women do, and put together a whole heap of opportunities for people to run and interact in a virtual world. So we had monthly challenges where we had people going and doing photo treasure hunts while they were running, or doing, trying to beat their PB in their own street, or trying to run all the streets of their suburb. And we also had all of our coaching team, instead of doing a facilitated coaching session like we normally would, we got them all to make a video with warm-ups and drills and a session that people could run. So, and then encouraging people to then post their runs and share what they had done. So I think what we found was that giving that opportunity to sort of share your successes and your struggles in our online group meant that it sort of gave some of those people a little bit more motivation, got people out and moving. We found that we've also found that people who didn't normally walk or run started doing it during COVID. So people who normally might play netball once a week or tennis once a week or whatever, and all of that was cancelled. So we found there were actually people who were starting to go for a walk because that was essentially all you could do. For a long time, the only way you could actually catch up with someone in person was to go for a walk and be socially distanced while you were walking with them. And so what we tried to do then was to actually harness that and try and encourage people to keep moving and encourage people to keep that up post lockdown. And we found we actually grew in numbers because people had started getting that sort of activity happening as a way of getting themselves out of the house and maybe, away from the kids and the housework and the 4 walls they'd spend all day in, and going for a walk for an hour, and then finding us and seeing the sort of stuff that we were doing and trying to tap into that and join as well. So, yeah, I think that's
right.
What we did.
Thank you. Thanks very much. Bronwyn, what can you tell us about what your experience of COVID-19 and the gaps that you identified? Sorry, before I move on, Kirsty, was there anything that you wanted to add in there?
No, all good.
No, all good. Okay. Bronwyn, so what gaps did you see? What was your experience like, and what did you do during this time in your role?
Yeah. Well, thanks, Sandra, and thanks everyone for giving me the opportunity to speak to you today. And I'd just like to acknowledge that I'm talking to you from the lands of the Boonwurrung people of the Kulin Nations, and pay my respects to elders past and present. We had a different experience, I suppose, because the National Growth Areas Alliance is hosted by the City of Whittlesea, but we actually represent and work for 20 councils right across Australia. And as we all know, different states had really different experiences of COVID and lockdown. And so in those first months, when there was a lot of turmoil, and what we've heard is from everyone who's spoken thus far about that real scramble to try and figure out what's going on, we had to try and take a step back and try and look at the bigger picture, because our role is not necessarily to be hands-on, you know, helping community members or helping councils to do their job, but it was to provide, you know, some research and some policy settings and some sort of one step removed assistance. So in the midst of us personally trying to figure out how to keep our jobs and how to stay relevant, and, you know, all of that, how we actually go to work as a team. We're 4 part-timers, which we had to downsize to 2 part-timers. And how do we still get everything done? So in the midst of all of that, we tried to really consciously take a step back and say, what is going on in this situation that is different, that we need to understand a bit better, that might present some opportunities for positive change down the track? So what we did was identify this shift to working from home as something that is really has the chance to transform the way people in growth areas, and by growth areas I mean those outer suburbs, like in the city of Whittlesea, but in Melbourne that's Melton and out at Wyndham and up at Mitchell Shire Council, Hume, Casey, Cardinia. So right on that periphery of the city, where people predominantly work. You know, there's a lot of people who commute for hours on end every day to get to the office or to get to the workplace. So what did working from home and cutting out all of that commuting mean for people, and what could it mean in the future? So we did some really interesting research around that, found that 57% of people in the outer suburbs were working from home and predominantly enjoying it and were being more productive. And we also found that 2/3 of them wanted to continue in some way to work from home. So whether that is all of, you know, the positives that came from working from home, and people told us that was, you know, getting more sleep because they weren't leaving the house at 6:30 in the morning to get to the office, more time with family. They actually had more time to do activities together as a family or to exercise. Now, bear in mind, this isn't the same experience for everyone, and we're talking at that sort of high level from a national perspective. So while everyone's experience was individual, what the high level data found was that there are real opportunities for families to perhaps function a bit better when one or both parents are not spending hours each day commuting. So we were able to then combine that with some fantastic research the City of Whittlesea did around gender equity in employment, which found that in the outer suburbs of Melbourne, there are an enormous number of women with bachelor degrees and higher who are not working in that field, who are not working at the managerial or professional level, but through the tyranny of distance and jobs in their professional field being in the city or on the other side of town, they've had to take some closer to home work that might not pay very well or might not provide them with the career path that their qualifications provide. And in that sense, there's also in the outer suburbs of Melbourne a lot of women with those qualifications earning less than $65,000 a year. So we tried to look at all of those things together and think, where do we take this now? And from an Australia-wide perspective, what are those opportunities for women, predominantly who are perhaps underemployed, because they need to stay close to home? What are the opportunities also for men who have maybe sacrificed a lot of their time with family and caring responsibilities to have to, you know, travel 2 hours each way to work, for example? And what we're putting together now is some positions to take to the federal government to say, look, this is the opportunity in the outer suburbs. Let's not go back just to the way things were before, but let's look at how communities and families can function better if they can work and gain some financial independence, especially for women, by working at home or close to home. So that's where we've got to.
Thanks so much, Bronwyn. That's really fascinating, and I'm looking at the questions that we've got coming up as well. We're running out of time, so what I'm going to do is I've got a question about what does leadership look like, and how do we for all of you. So I'm going to whip around and ask you very quickly if you could just maybe in a couple of words tell us what you think what leadership means. I'll start with you, Gulhan. How would you describe leadership?
Oh, I think I just described it. Leadership is just in the chat box. Sorry, leadership is just realizing that there's an opportunity and understanding very quickly that no one else is going to do it, so you've got to do it. And in terms of leadership, I've never had a position in my professional life where I didn't have a mentor or a guide or a coach or another woman in leadership that wasn't there to guide me. So I absolutely think women need to be mentors for other women.
Thank you. Thanks very much. Kirsty and Sarah, how would you describe leadership for you?
Thanks, Sandra. I think that to me, leadership is it's being motivating, and you can be inspiring others, and you don't need to be doing amazing things. You can just, it's in your everyday life is how you inspire other people. And for me personally, I try to do that for both work and through the running club. So being motivating, being engaged, including people, you know, thinking about the people who don't have that loud voice and making sure that their voices are heard and reaching out to those people. So yeah, so that's a real quick summary for me what leadership is.
Thanks. Sarah, did you want to add to that?
No, I'm Kirsty, but that's all good.
Kirsty, sorry.
All good, no problem.
Really,
Sarah and I are trying to take it in turns.
On one screen. Sorry.
No, we're all good. We're just taking it in turns to make sure we don't take up too much time. So I'll let Sarah speak for me.
Apologies. Lisa, what would you like to add to that?
Leadership for me is, well, I come from a long line of matriarchs, and I'm playing a part. For me, it's actually just my mentors and my mother and was my grandmother. That's who I am. That's where I learned where to lead from. My leadership is based in community control. My leadership is based on teamwork and ensuring everybody is working together and actually achieving together. And that's for Aboriginal people, as we know the inequalities that's happening for Aboriginal people in this country. That's where I lead from, which is, you know, all the work that we do is mainly women in those positions of actually leading Aboriginal people's spaces, and it's actually so everything everyone else's experience, and on top of that being an Aboriginal person, a First Nations person in this country, which is absolutely disastrous. Not much has actually moved forward. How we do that, I don't leave the ground. I stay on the ground with my workforce, and I ensure the best possibilities for young Aboriginal people to have an opportunity to succeed, and their families.
Thanks, Lisa. Thank you. It's really pertinent, and I think that to really think about that Aboriginal leadership and the role of Aboriginal controlled organisations and self-determination is something that should be front and centre of our minds all the time. Bronwyn, what's your leadership messages?
Look, for me, what I've learned over the years is about finding what I'm good at and using those skills. So, you know, I think what's happened during COVID is a good example of finding the gap and finding out what I can do that, you know, I don't want to be in there competing for space and trying to sort of achieve the same outcome as everybody else, but there must be something that is needed that I can do. And when you can do that analysis and find out what that is and pursue it, I think it's a great thing to do. And just a little anecdote for another International Women's Day event that I was part of, we were talking about having managers and senior managers that are women, that are female. And I made a list, you know, and what really surprised me, because I've always felt like I've had women mentors and role models, but in my nearly 30 years in the workforce, I've only ever had 2 female managers. And it really surprised me. We're still not there, you know. No. We're still not there.
Yeah, thank you. I agree with that. I think we've come a long way. We've still got a long way to go. Thank you all for your contributions. I am looking at the questions in the box, and I can see someone that's asking why haven't we answered all the questions. I've been trying to make sure that we hear from the panelists and that we do get to that. But one of the questions was about how does leadership address the needs of transgender and gender diverse people? And I can speak from my personal position on that, is that while I would describe myself as a feminist and working to achieve great outcomes for women, I do that with a lens on that is an intersectional lens, where I am thinking about all of the things that create oppression and discrimination for people, no matter what their identity, and really be focusing on inclusive, and I use that word when I describe leadership, inclusive leadership that takes into account all of those different the different characteristics, the different ways that we identify and incorporate those needs of those needs, I suppose, to try to address the different needs that we have across the community. So I think for me, leadership is really about inclusive practice and inclusive thinking, and making sure that no one's left behind. And just because we're here today to focus on women and women's achievements and the challenges, that doesn't mean we're not thinking about the issues for transgender people and women and others in the community who are gender diverse. And so on that note, I'd like to just say thank you to everyone for coming today. Thank you for attending. Thank you to the City of Whittlesea for holding the event. Thank you to the fabulous panellists. I think we could sit here and talk for a really, really long time. I think the things that have struck me is the willingness that all of you had to take on the challenge that COVID-19 presented and the individual challenges, to be flexible and creative and how you responded to those, and to really think about what it meant for those in their community and how you could best support them. And I think one of you said, I think it was Bronwyn that just said, seeing a gap and doing something about addressing that gap and sharing that message about what needs to be done, that's leadership. And it doesn't, and you can do that in your everyday life. It doesn't matter whether you're at the top of the pyramid of an organisation. Leadership's happening around you all the time, and we need to harness that when we see it in ourselves and harness that when we see it in others, and that goes to the importance of mentoring other women and providing support for other women. So happy International Women's Day. My final word is, this is actually my last day at Women's Health in the North after 15 years, and what a great way to go out. Thank you all for bearing with me with my little glitches in my online moderation of the event. But I just want to thank you all. It's been a pleasure being with you all today. So thanks very much.
Thank you.
And virtual clap to all of you.
Thank you.